Distinguished colleagues, there are three clerks who are really here for the three committees. I've not seen that of appropriation. Is that of appropriation here? Yes, I'm sure he's on his way. Okay, he's there. I'm sorry. Yeah, because I saw him yesterday. So that means 4 clerks, are really here. Our resource person, my chairman of the primary healthcare support team, who is really here, Dr. Ben. Good afternoon. Let me just add to what my honorable colleague, Honorable Jumbo, said. Today, the health sector is in shambles. And given our responsibilities today, as members of the various committees in health, as well as appropriation, we need to really work together. We have been working, in fact, since last year, really, because we attended even a retreat in Ghana on financing health sector, in particular, the primary healthcare level, which is really the foundation. And no time is better than this time, around when we are still working on the budget. Though we have gone a long way in the budget defense, I know that in our committee, that is healthcare services, next week we'll be taking on 2 important agencies, which is National Primary Healthcare Agency and the National Health Insurance scheme, really, by next week. And there are major key advocacy visits, which I would also, want to share, which we want to embark, by next week. That is to the Senate President and our Speaker, on 2 key issues. One, the issue of the 1% implementation of the Health Act, particularly that aspect. Section 10, which stipulates 1% from the consolidated, fund, and then 2, increasing, the 15% Abuja declaration. We know that it's impossible as we are today, to really fully implement that. But you recall, for some of us who were in the Owerri retreat, we agreed that at least for this year, 6%, of our budgetary allocation, should go to really health. So if we are able, to achieve 2 things, definitely would have achieved a lot. And except we do that, there is no way the health sector can get out of its present predicament. And I've always been saying that it's very sad, if you consider 2 major developments today that are happening in our Nigeria. 2 weeks ago, the former president, Ibrahim Babangida, returned from medical tourism. He was sick for almost over 3 months outside. And today our president is also, outside on medical tourism. It's not a very good thing. That means all of us, leaders today, have a major role to play in terms of health funding. If we don't get it right now, I don't know when we're going to get it again. Mr. Ben, I'm sure when he stands up to talk, will tell us more about the Gavi transition. Because by 2020, the Bill Gates, whatever, will no longer support immunization, process, vaccine procurement, and which is in billions, about $460-something million must be funded by Nigeria. And the earlier we start in this 2017, the better for all of us. Because else one day, believe me sincerely, the whole thing will collapse. So as at today, the 4.7% that has been allocated to health is unacceptable. And I'm happy with members of the appropriation committee who are here. You know, Honorable John Bull was in the Owerri as well as the Ghana Basin, last year. We must put an Akwa. We must all work together, work together so that all these struggles that we have been embarking upon will not go in vain. So I will say we are not going to rest until we succeed. So let me conclude by thanking the organizers for giving us, creating this opportunity for further rapport, on budgeting, the right amount to health. So let me conclude by saying that Aluta continua victory asserted. Thank you.